Well, good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. I want to introduce you tonight to a really interesting Israeli biotech company and the CEO and co-founder, Asher Nathan. He is the CEO and co-founder of Neotex Therapeutics, an Israeli oncology company. They've got some interesting technology that might actually, one of them, act like a vaccine, which is really quite fascinating. We're going to have to find out about that. And he's also exploiting some artificial intelligence as well. We're also going to chat a little bit about Israel and Startup Nation, which we've heard a lot about. They're a little bit beyond startup. They're sort of middle of development, but I think Asher can tell us a little bit about the Startup Nation and how really from both a biotech standpoint, a technology standpoint, and lots of other sectors, Israeli has been a catalyst, a source of an incredible amount of innovation, and why and how in such a small country. So, Asher Nathan, welcome to the show, sir.
Well, thank you very much. Thanks for having me. I really appreciate it.
My pleasure. And you're coming to us from Tel Aviv.
Yes.
Excellent.
It's a wonderful day out here in Tel Aviv. Well, it's almost evening, but still great weather, and probably head to the beach after the interview. So
fantastic. So tell me a little bit about Neotech Therapeutics and what your company is and your products, if you could, sir.
Sure. You know, it kind of sounds like a start of a joke, like what happens when you cross egg with a plant or something. So we started the company with the idea of what happens if you cross a very experienced management team that knows how to develop drugs with the visions or visionaries of 3 Nobel Prize winners, because each of them have a very unique aspect of looking at how to develop new technologies. And I think the intersection between the two of them is when really interesting things can happen. So with that kind of introduction, we were looking at ways of accelerating the whole drug development process. So, you know, one of the problems with drug development is everyone knows it's a very long process and it's very expensive, and the probability of success is often less than the odds that you would get in Vegas. So, you know, we have to convince investors not to go to Vegas and give us cash. And so to do that,
I've heard things like 8 to 10 years and $1 billion.
Yeah, those numbers they're somewhat controversial, but they're all true, right? I mean, it's in that ballpark. And, you know, the probability of success for a drug that made it all the way into clinical trials, so it's being tested in patients, is still only about 12%. So still very poor odds, and huge amounts of money and time are needed.
Why would a smart guy like you want to take those kinds of risks?
Not so smart. That's the simple answer. We don't want to take those risks. And that's why we try to come up with ways of kind of like, you know, what's the Vegas equivalent of counting cards. So having a way to be able to accelerate that process without going through the entire, 12 years and low probability of success. And to do that, what we did was we looked at, you see, in biotech, as opposed to just about every other field that I'm familiar with, information does not always equate to a successful, what I want to say, information is not always positive. So if you look at Google, any information they have, well, that's worth something. It's worthwhile to know it, right? But in biotech, if you have a failed drug or a drug that failed in a clinical trial, no one wants to touch it. Its value essentially goes to zero. And I don't really understand why, because, you know, developing a drug is kind of like groping in the dark anyway. And knowing what not to do is often as important or more important than knowing what to do. So what we do was look for drugs that had failed in late phase clinical trials. And we try to see, okay, did the drug fail because the drug didn't work? or maybe the trial failed to show activity of the drug. To just give a stupid example, if you have a great drug that could cure cancer, but you put it in a clinical trial to see if it cures headaches, well, obviously it's going to not have a positive result, but the drug could be fantastic. It was just a trial that failed, not the drug.
Viagra was a heart disease drug, wasn't it?
That's absolutely right.
Had a side effect that they were a little bit surprised with.
Yeah, a little bit surprised with and made a lot of money with. So yes, absolutely. So we looked through 150 failed drugs in oncology until we found one that we said, hey, this drug failed for reasons that we think we can fix. And therefore, we think the probability of success is actually higher. And we were able to buy it for very little money up front. So that's how we kind of short-circuited the whole system.
Fascinating. And so what is this drug and what does it do? Or what do you think it does?
Okay. Well, what the drug does is it's very interesting. So what's very interesting in immuno-oncology, which is the field of trying to manipulate our body's own immune system to kill cancer, is that there is almost for every idea out there, there's at least 5 or 10 different companies trying that particular idea. And so there's a lot of competition, and there's also been there's been one major success, and that's been with the checkpoint inhibitors, which are a certain type of class of drugs that basically stimulate the immune system to kill cancer. And now it's the go-to drug for many types of cancer today. It's probably the #1 selling oncology drug or class of drugs in the world. And while it is a great drug, and maybe 44% of cancer patients are eligible to take it, it only works in about 12 or 13% of the patients.
Oh, really?
So still a lot of room for improvement.
Yeah.
So what our drug does is, I think it complements those checkpoint inhibitors in a very interesting way. It acts as if it was like a vaccine. So it stimulates the immune system by coating the tumor with bacteria. Bacteria is like, waving a red flag in front of the immune system. It really pisses it off. So whereas a tumor or cancer, that's our own body. It's just a little bit different. So it's very difficult for the immune system to figure out what's going on and to kill it, to identify it as being something that is worthwhile to kill. Bacteria is not like that. So by coating the tumor with bacteria and then stimulating the immune system to kill it, we think we have a very elegant way to help checkpoint inhibitors work much, much better.
How does the bacteria find the cancer cells?
Oh, that's a great question. So the drug has 2 components. One component is it's not an actual bacteria, but it's a molecule that's derived from a bacteria, so it can't really cause any disease on its own. But the other side of the drug is a antibody that sticks to tumor cells that have a certain target, and only tumor cells have this particular target. It's present in most cancers and in most patients. So if you have this target, the drug will stick to it, and it doesn't stick to the vast majority of normal healthy cells.
The vast majority. Does it stick to some?
It sticks to some, like mostly in the GI tract. So there is some mild immune reaction in your, like some nausea or something. But if you have pancreatic cancer, I think nausea is a major issue.
And this is effective in all or most cancers?
In most cancers, we believe. Probably not all, but we're still testing to see where it is. Now, we did do a phase 1 clinical trial, and in phase 1 clinical trials, it's really the worst of the worst patients. I mean, it's patients who are basically ready for a Hail Mary. One of them, for example, had pancreatic cancer and had failed 3 lines of therapy before they came to us. The tumor was growing exponentially, and we gave them our drug with the checkpoint inhibitors. And typically, checkpoint inhibitors do not work on pancreatic cancer at all. And this patient now has been cancer-free for over 2 years. So that was a very exciting finding that we found. And there's been other patients who also have responded to our drug that you wouldn't expect immunotherapy to be helpful for.
And how many people have you had through phase 1 clinical trials?
We've had a total of 37 evaluable patients.
And what stage of the clinical trial process are you now?
So now we're going to, we're in the middle of a phase 2 trial in lung cancer, and we're about to start a trial for esophageal cancer, and where we're going to focus on lung and esophageal to see how well it works in those settings.
And assuming it works, when do you think you might be able to launch?
2026 or 2027 at the earliest.
So 4 years away.
Phase 3 trial. But to do a phase 3 trial that will go, if that's successful, then the drug can go for registration.
Sounds exciting. Sounds very exciting. For any of us. We all know people that have passed away of cancer and people that have fought cancer. And so this
I can tell you one thing: everybody in the company, their heart is in the right place. I mean, I didn't start this company. Yeah, we wanted to be financially successful. No one's saying no, but we really want to have an impact on cancer. That's why we all went into this field. That's why everybody in the company is excited, because we think we can do something here that could be important for patients.
I used to be in the pharmaceutical industry, and I understand completely. It's really quite beneficial to your attitude when you're thinking that you're potentially saving people's lives, improving their quality of health.
I think so too. I hear a lot of times, from people with conspiracy theories about how everyone could cure cancer, and we've already cured cancer, but no one wants it because we wouldn't make money. And I got to tell you that personally, I find it to be ridiculous, just knowing the people involved that are doing this, and also knowing how hard it is to actually cure cancer. I mean, I invite people to try it at home if they want, but it is a very difficult nut, and it's not for lack of trying. I assure you, it's just a tough thing.
We're going to take a break for some messages and be back with Asher Nathan and his cancer company, his oncology company, and talk a little bit about Israel and the Startup Nation. Stay with us, everyone. Back in 2 minutes. Welcome back, everyone, to the Brian Crombie Radio Hour on Saga 960. We're chatting tonight with Asher Nathan. He is the CEO of Neotex Therapeutics Limited, an Israeli oncology company. He's got 2 interesting products in development, and they sound pretty exciting. And we're going to chat about those products, and we're going to chat a little bit about the Israeli Startup Nation, which we've heard lots of things about, read books about, etc., and talk a little bit about Asher's background. What brought you to? Did you grow up in Israel? Did you move to Israel? Tell me a little bit about your background, sir.
Sure. I did not grow up in Israel. That's why I do not look like this. I'm originally from Chicago. So I moved to Israel when I was 18. Pretty much I got on the wrong bus, I think, and ended up in Israel. No, I came to Israel. I wanted to see what it was like. I worked on a kibbutz when I first got there, and then decided to do, I went back to the U.S. I did undergrad and decided to do my graduate work here in Israel at Hebrew University.
So you got a bachelor's in chemistry and biology from the University of Illinois, but then you were, as you mentioned, the Hebrew University of Jerusalem. Yeah.
It was an interesting transition. This is a real quick story that maybe it's not so relevant, but I never liked Hebrew, and I don't like foreign languages in general. I have a hard time with them. And biology is really all in English anyway. But Hebrew University has a requirement that you have to pass a test in Hebrew in order to get the degree. And so in the 80s, it was so, as Israel is in general, it was so disorganized. I thought if I don't sign up for anything, they'll never even notice that I didn't take the classes. Nothing was computerized. In Chicago, everything was computerized. There's no playing. There's just some secretary and some, So I just said, forget it. I'm just going to skip it. And so I didn't go to any Hebrew classes. At the end of the year, I get a note: you're being thrown out of the university because you didn't go to Hebrew classes. Long story short, I went to the dean of the Hebrew classes, and I said to him, I didn't take Hebrew last year because I thought I can get away with it without taking it because everything was so disorganized. And I didn't take it because I don't like it. I mean, I just don't want to be bothered with it. I'm a scientist. I just want to be doing science. And he said to me back, he said, hey, Asher, you're the first guy. I mean, I've heard every excuse you could imagine. You're the first guy who actually just told the truth. And because of that, I'm going to reward you, and I'm going to give you a one-shot deal to take the test. So when I went to take the test, I hired Ben Yehuda's granddaughter or something, the guy who wrote started the modern Hebrew language, and there's a Ben Yehuda dictionary. So one of the top people in Israel, she lived right by me. And I said to her, I go, don't teach me Hebrew. Just teach me how to pass the test. So half the test is like a big you have to write a small paragraph or two on some topic that they'll pick. So I didn't know what topic they're going to pick, but I told her, give me two paragraphs on the Israel-Arab conflict. And I figured that's a question that's going to come up pretty in Israel. So she wrote the 2 paragraphs in the best Hebrew possible. So I memorized it word for word. I get to the test. There's no question at all about the Israeli conflict. I was really disappointed. So they asked something like, what do you think about the man's mission to the moon? So I wrote back, that's a great question. It kind of reminds me of the Arab-Israeli conflict. I got the highest grade ever, I think, on that report. They said they've never seen such high-level Hebrew.
Fantastic. So you read it. Is that correct?
Yeah, I could read it. I could write it. I talk it. My wife's Israeli and makes fun of my Hebrew all the time, so I'm used to it. But,
tell me a little bit about.
I've been here for 30 or 40 years. So
tell me a little bit about Tel Aviv and the Startup Nation. There's this famous book that undoubtedly you've read and know about called Startup Nation. I've been to speeches. I've read the book about something about Israel that is really, catalytic in technology development. What's your experience? You spent 8 years in it would appear a bioventure kind of role. So you must know this from very up close.
Yeah, I know from very up close. Maybe it's something in the falafel. I don't know, but when I was graduating, so my professors told me I came up with some idea. This, at the very end of my doctorate, and I said, hey, I came up with this idea. What do you think? And I wrote it on the board, and he said, hey, that's a great idea. You should start a company. Like, I don't think that many people, at least in those days, no one was saying, no. I don't think that the typical view in the U.S. was, stay away from corporate America, and you should do postdoc and everything. But my professor said, start a company. I said, I don't know anything about starting a company. And he goes, don't let that stop you. Just do it. You could do it. You have it in you. And because of that encouragement, I started a company. I raised money. I without any real education as to how to do it, or if I'm doing it right or wrong. and it was a real experience. And I think that
So you're
people
saying
like,
that Israel is even more entrepreneurial than the United States, than Chicago?
I would say so. I would definitely say at the time for sure, and even today, I think it's even more entrepreneurial. More people are willing to take that. You know, you know, it's always in. It's kind of in that in everybody's mind, collective mind. Like, how can I turn this idea into a company?
Yeah.
That's kind of like what everyone's thinking about, even in biotech.
In Startup Nation, they talk about really very strong social capital. Some of it they suggest comes from people that fought together in the Israeli military. Other ones from people that were at school together, at kibbutzes together. And so this idea that people collaborated more effectively, more efficiently than they might in the United States. Is that true? Do you think?
I think I definitely think it's true to an extent where you have this cohesive groups from the army, but sometimes I think that the army also gives you kind of a skewed view. So I've been involved in companies where a biotech company was run by someone who was a very successful Air Force pilot. And, you can be a good Air Force pilot, but you really have to know biology in order to be, I think, so sometimes it's a little bit too much from that old boy mentality. The other thing is high tech is very different than biotech. In high tech, you have a great idea. There's so many people here in Israel who are experts in the high tech world. And I think it's much easier. In biotech, while people are great in the science and in the research side of things, I think that there's less knowledge here on clinical development, doing clinical trials with patients, because they have less experience.
Yeah.
And so when I started this company, we went to the US to look for the best, very experienced clinical trial people to be the chief medical officer who could design these trials and run them effectively.
Can you raise money in Israel for new opportunities?
You can raise money for new opportunities. It's harder to raise large amounts of money. The beginning money is easier in Israel. I think once you get to a certain point, though, you're going to want to have a U.S. Investor, and particularly you're going to look for a potential IPO. Even though there's no such thing as an IPO in biotech anymore, but when there was, or when there will be in the future, then yeah, I think you're going to need more U.S. investors and not just Israelis. But to start a company here in Israel there's a lot of money out here.
And I've heard that we don't hear about the post-secondary institutions that much in North America, but that there's some incredibly good universities in Israel. Is that correct?
That's absolutely correct. Weizmann Institute is world famous, and a lot of the biotech that comes out of Israel originated at Weizmann. So there's that as well.
Can I ask you a question?
Yeah.
Israel is a smaller country. It's only 75 years old. It's in the middle of a bunch of unfriendly neighbors. It's a long way from big markets in the United States, et cetera. Why do you think it's been so successful?
I think that the fact that we are surrounded by people who, in an area that's not been particularly friendly to us, and that we have constant threats, existential threats, in some ways makes you thrive, makes you resilient to adversity. And you see, I don't want to use the word, I hate to use the word, but you almost see miracles in front of your eyes here. I mean, Israel shouldn't be in existence if just by the probability of its success, and looking at all the countries that have been against us. But here we are, and when you believe in miracles, then they often could occur. If you don't believe in them, then you're not going to go down that route. But if you're in a country where miracles are everyday things, so you say, anyone could start a company and that we could all be successful. It kind of breeds that kind of thinking, I think, and that breeds a lot of success.
And I hear the beaches are pretty good.
And the beaches are great, and the falafel is wonderful, so that doesn't hurt either. I was once speaking at a conference, and I was the last speaker, and everyone was already asleep by the time I got up on the podium. I'm looking around, there's not a single person awake. And so I'm like, I slam my hand on the podium and I say, okay, I started a company in Israel. Could anyone think about why? And so people are saying, oh, startup nation, this and that. I go, that all might be true, but it's really the best hummus and the best, some of the most delicious food that makes me want to stay here. Maybe that's why I want to be there, but makes me want to stay is good food. So, and it reminded me of when they started one of the San Diego, when it started as a biotech hub. So I heard some of the VCs talking about how they got San Diego to be a biotech hub. And that was by inviting CEOs from the East Coast to play golf in January in San Diego. And, that's really what they said. That was their theory, and it worked out very nicely for them. Now it's a thriving biotech.
Do you get scared about terrorism and missiles and things like that?
I don't, and I don't think, and for the vast majority of people, they don't. People don't. I mean, we don't really. You don't see it much. I think the news always makes it worse. But personally, I've never seen any a terrorist attack. I don't know anyone who has. I don't think, except for people who are in special units. But the average citizen has never seen it. The chances of you being attacked are much less than you being hurt in a car accident. The drivers here are scary, and that and that is pretty. That I am afraid of. But other than that, terrorism, it's kind of random, and but it's very, at least right now, it's extremely small scale, and the chances of anything happening are exceedingly small.
The Economist magazine did a whole issue on Israel a couple of weeks ago. And one of the things that they talked about is a demographic challenge that there's an Orthodox sect that I guess don't believe in work, at least work out of the house. They work a lot in reading the Talmud, etc. And they're growing from something like 13 to almost 40% of the population. And they suggested that was a real issue from a social standpoint and from a productivity and government finance standpoint.
It absolutely is an issue. And I think that it hopefully will self-correct. In other words, how could they sustain that kind of their poverty of not working? At some point, you have to say, hey, I'm not bringing food on my table, and not enough people could support you to do it, then you're going to have to go out and work. I mean, even in the Talmud, many of the great rabbis were known merchants, and I think most, if not all, had professions beyond just studying the Talmud. So I think that I'm not telling anyone else what to do, but to me it seems like if you're not putting food on the table, you have a strong inducement to actually go out and work. And I think the ultra-Orthodox communities are seeing that, and I think they're starting to self-correct for that. I think you see more people joining the workforce, women working. So, and with today's new, post-COVID, where you can work from home very often, there's really not much of an excuse why not to, right? I mean, to be more productive.
I'm looking at an investment right now in Tel Aviv. Would you encourage me or discourage me?
An investment in real estate?
Yes.
Tel Aviv? I mean, I know Tel Aviv right now, there's a it's been the lowest point, I think, in 15 or 20 years, because things are not selling right now. So it's probably a good time to buy. I mean, I'm not an expert, so please don't come back. Please don't come back to me later. You told me to buy and I got screwed. But I think there's a good shot at, I think it's buy low, sell high. Probably a good idea. It's vibrant in Tel Aviv, and it's almost impossible. To find good housing there is difficult. So yeah, it's probably fine.
We're chatting tonight with Asher Nathan about his company, about Israel, about cancer and cancer drugs. We're going to take a break for some messages and be back in just 2 minutes with Asher Nathan to talk a little bit more after the break about his drug candidate. Stay with us, everybody. Welcome back, everyone, to the Brian Crombie Radio Hour on Saga 960. I'm chatting tonight with Asher Nathan. He is the CEO and co-founder of Neotex Therapeutics. It's an Israeli oncology company. He's got 2 drug candidates in development. One sounds really quite interesting. What it is a drug that has half, I'll use my simplistic explanation, half of it is a bacteria, the other half, for some reason, is attracted to cancer cells, and it finds the cancer cells, and the bacteria binds to the cancer cells, and because of that, the body's natural immune system is attracted to that bacteria and comes and destroys the cancer cells. It sounds like it's almost like a grenade that comes in, and it's the body's own grenades that are traveling around to kill stuff, but miss out on the cancer typically. But because of this bacteria, they don't, and they come and they attack it. That sounds fascinating.
I'm a little worried, Brian. I think you said it better than me, so I'm worried that you're going to be replacing me as CEO soon if you continue in this way. That's a good explanation.
Well, as I mentioned, I spent a bit of time in the pharmaceutical business and biotech business. Yeah. Now, it's interesting because, and maybe you can tell me why this happens. Cancer is really cells that are regenerating themselves on an accelerated basis, and it would appear that they almost attract more energy from the body naturally to grow so quickly. Why wouldn't that be something that the body's immune system would see?
In order for the immune system to see cancer, it can't see what's going on inside the cell. So there's a lot of craziness that's going on in a cancer cell. It's losing control. Most healthy cells are under very, very, very finely controlled systems. And cancer means it's losing control and it's dividing without those control mechanisms in place. And so, but those are happening inside the cell, not on the outside. You have this, imagine a blind man looking at each feeling, and you can look on YouTube, it's really fascinating, type T-cell killing cancer, and I think it'll be very fascinating to see it. But it looks like it's like amoeba groping, trying to feel something on the outside of the cell that says that there's something wrong on the inside.
On the inside.
And so that's the problem.
And you say you came up with this by finding a drug that had failed a clinical trial previously.
That's correct.
And you said you researched like over 100 different drug candidates to come to the conclusion that this was the one that you wanted to buy. Did it go through full phase 1, phase 2, phase 3 clinical trials?
It did. It went through a phase 2-3 clinical trial, and that's where it failed. But we convinced ourselves, and I think there's very strong evidence to show the drug is active. It just it wasn't in the right. It didn't have the right setting in order to show that activity that we now have. And
so
it was
in a more effective clinical trial, really.
Yeah. I just want to talk for a second, Brian, if I can, about the other technology before we run out of time, because I just want to mention, I think it might be interesting to your.
Yeah, please. This has got AI associated with it?
Yeah, because AI is now very hot, I know.
No.
And this is a very unique application of AI. So, people have been using AI for drug discovery for maybe the last 5 to 10 years. And today there's probably not a single pharmaceutical company that doesn't use AI in the early initial stages of screening molecules to see if they can be potential drugs. And the difference between what we have and what the rest of the world has, and there's also hundreds of new drug discovery companies popping up almost on a daily basis. But the difference is, AI is essentially connect the dots, right? So you have a data set, a training set, and it has data on that training set. And AI basically runs connects those dots in such a way so that you could know what will be for molecules that haven't been tested. That's the predictive power. That's the predictive power of AI. But for drug discovery, because the chemical space is so large, the predictive power of artificial intelligence gets you in the right ballpark, but doesn't give you accurate data. It can't tell you exactly how strongly a molecule will bind to its target. And because of that, you have a little bit of a problem, because then at one point you have to stop. The computer is very fast and it's very efficient, but at one point you have to stop using the computer, go to your chemistry set, start making molecules and testing them. And that takes a lot of time and effort. Typically, it's the bottleneck that takes 3 to 5 years in the drug discovery process. And all the other AI companies, at least that I'm aware of, they work on the first part of screening millions of molecules to get down to maybe 20 to 100 or a couple hundred. But then you have to actually make the molecules and test them, and then test them each time. As opposed to our technology, which doesn't rely on connecting dots, but essentially is a way to accelerate the physics that's involved in coming up with these solutions. So in other words, quantum physics is the science that governs how two molecules interact. And the equations are well known. They've been known for 100 years. And, as opposed to AI, like look at gravity. If you don't get an approximate answer about gravity, you can land a man on the moon and exactly, within 5 inches based on the formula. So formulas are always better than connecting dots and machine learning. And so the idea was, the problem with quantum physics is it's so complex and the equations are so long that it would take about 1 billion years to actually go through the quantum physics to come to a solution, which is obviously not too practical for drug discovery. And so what the technology that we have here is one that accelerates the mathematical equations of quantum physics so that it's useful and practical and gives you exact solutions, not approximate ones. So, sorry, go ahead.
This isn't a product, this is a technology.
Yeah, it's a platform. It can make drugs faster than anyone else.
And you can, you license it out to other people? You sell it to other people?
You can license it out to other people. Yeah, I mean, it should be licensed out. It's not only for drugs, by the way. It could be useful for almost predicting any two molecular interactions accurately. Just an interesting antidote. The group that does this is located in Berkeley, California, and I'm in Israel. And I get a phone call at 4:30 in the morning one day from the chief scientist. Asher, we dissolved salt in water. And I'm like, wow, that sounds really fascinating. Could you call me back in like 5 hours? And no, he goes, no, you don't understand. We modeled it on a computer. No one's been able to do that before. Salt is ions and they're very energetic. And so it's very difficult to get to any kind of accuracy there. And no one else could do it. We're the first people in the world who are able to do it. We're going to there'd be a paper in Nature, and they were just really extremely excited to be able to as a proof of concept to be able to do that. Anyway, I think the difference is, imagine if you have to make a cupcake, and you don't know, but you're not allowed to taste it, so you have to make, each time you want to try different ingredients, you just have to make thousands of them, right? If you want to make the best cupcake without someone tasting it first, you don't know which one to do. So you keep on having to make lots and lots of cupcakes. But with Aero, because it's so accurate, each time you make it, you can order it. Is this better or worse than I had before? And so you can get to drugs a lot faster by basically, in the analogy, being able to taste it each time, and then based on the taste, putting a little more sugar, a little less, a little more of this, a little less of that. So that's
my experience with pharmaceutical development, biotech development, was a real trial and error kind of process. And what you're doing is you're accelerating that by predicting mathematically which are the ones that are going to work, rather than having to go through all the trial and error. Is that correct?
That's absolutely correct.
Absolutely fascinating. Tell me, your company, it's a private company, not public. Is that correct?
It's private at this point, yes.
And how long have you been around?
We've been around since 2017.
And give me a sense of how much money you've raised, if you could.
Sure, 85 million to date. Our largest investor, we haven't taken venture capital yet. Our largest investor is Larry Ellison of Oracle fame.
Yeah.
So.
And you're in the market today, or you're thinking of going to the market to raise more money?
If you're in biotech, you're always in the market, first of all. But yes, we are in the market today. It's been very difficult raising money over the last year, because the biotech markets have been very depressed and very difficult to raise money for anyone. It's been very difficult to raise money.
And you're in a phase 2 right now. How much money do you need to complete that phase 2?
Well, we would like to raise a total of 75 million to do. We have enough money to finish this phase 2, but we have other trials that are planned that are equally, if not more, exciting than the ones we have. And we also want to develop the artificial intelligence and quantum physics technology as well. So,
and you have to go to a phase 3 as well?
I'm sorry?
You have to do a phase 3 as well for this product?
Yeah.
How many people in the phase 3, and how expensive is that going to be?
It will depend on the phase 2 results. Once we have the phase 2 results, we'll be able to know if we can go to the phase 3, if we should go to the phase 3, and how many patients. It'll be based on the results of the phase 2. So,
I've always wondered about phase 3s, and maybe you can give me a point of view on this. If you prove in the phase 2 that you work, and you believe it works, is it ethical to do a phase 3 where half the people are actually not getting the drug, think they're getting the drug, but don't get the drug because you're doing a double-blinded study?
That's a great question, Brian. I mean, and one that many people ask. I mean, the problem with phase 2s are, statistically, you could get, first of all, many times, if the trial was not a randomized and controlled trial. So if you're not comparing two different groups, then you don't really know if your results are positive or negative. And they seem to be, you could say they're promising, but only controlled randomized trials are the gold standard for knowing if a drug works or not. And only a large, fairly large number of patients are needed to be able to prove it. So yeah, you can say you had a positive phase 2 trial, but I wouldn't be confident that the drug at that stage actually works. It could just be a statistical anomaly.
So you got to go through the phase 3.
You have to go for the phase 3 to really prove it. Now, if 100% of the patients are responding when 0 should, then it probably is not ethical. And yeah, but for most cases and for most trials, you would probably need to do the phase 3 to prove that the drug actually works.
We're chatting tonight with Asher Nathan about his company in Israel, about the oncology products he's got under development, and a little bit about the Israeli economy. We're going to take a final break and come back with some concluding comments in just 2 minutes. Stay with us, everybody. We'll be back in a minute. Welcome back, everyone, to the Brian Crombie Radio Hour on Saga 960. I'm having an interesting conversation tonight with Asher Nathan. He is the CEO and co-founder of Neotex Therapeutics. It's an Israeli oncology company. It's private. He has raised $75 million to date. He's out in the marketplace looking for another $85 million to take his products through phase 2 clinical trials and some other interesting trials that he's got. It's a fascinating company where he's attacking cancer by really developing a drug that has two halves to it. One half is a bacteria. The other half is something that actually finds and attracts itself and combines itself with cancer drugs. Once it finds that cancer drug and attaches to it, the bacteria attracts the body's own immune system. And in combination with some other drugs in the marketplace, it attracts the immune system. The immune system finds those cancer cells and destroys them. Sounds like a fascinating technology. He's got another platform technology that is using AI to more quickly predict which drugs will actually work. Asher, you were saying that it's challenging raising money today in the biotech sector, and I think that the tech sector was down substantially. It's come back up, and so the tech sector is doing well right now. I think because of all the excitement on AI and other things. What do you think is going to happen in biotech? Is biotech going to come back to a resurgence as the stock market comes back up, as technology comes back up?
Biotech has to come back up because people still are getting cancer, still getting heart attacks, still dying. And so after, traditionally the markets go down, then they come back up, but they have to come back up if we want to be able to continue to make advancements, medical advancements. It takes money and it takes investment to do so. So I believe it will come back. I just don't really know when. I don't know if anyone does.
And when in the pharmaceutical business and the biotech business, there's a real focus in the Silicon Valley and San Diego, in New York and Boston, in New Jersey. Are those the places where you got to go to get money?
Yeah, those are traditionally the places you have to go get money. I think today many biotech companies like ours is focusing more on family office and less on VCs. The VCs are essentially supporting the companies that they already have in their portfolios, not making that many new bets. So, at this point in time, I go throughout the world, throughout the United States, and in places I've never been before, just because there might be some family offices out there that
want to invest.
Yeah.
Well, good luck, because it sounds like
Thank
you got some interesting drug candidates. If people are intrigued by your company, about your products, is there a website that you can direct them to?
Sure. It's www.neotex.com.
Asher, it's been a pleasure meeting you and chatting, and good luck, because as we talked about, everyone has been touched by cancer, and
Sure.
So I hope that you and some other companies that are targeting cancer have great success. I really appreciate the efforts that you're employing in that area. Thank you so much.
Thanks so much for the interview, Brian. I really appreciate it as well.
That's our show for tonight, everybody. Thanks for joining us. I remind you, I'm on every Monday through Friday at 6 o'clock on 960 AM. You can stream me online, even from Tel Aviv, Israel, at www.saga960am.ca. All my podcasts and videocasts are available on my website, briancrombie.com. Good night, everybody. Thank you, sir. Appreciate it.